What is diabetic nephropathy? Do you know that diabetes mellitus is the leading cause of chronic kidney disease in your country? Yes, diabetes accounts for 44% of new cases of kidney failure, and more than 35% of people aged 20 years or older with diabetes have chronic kidney disease. Many people with diabetes mellitus often underlook this connection of diabetes and kidney damage. Therefore, in today's video, we shall explain to you what diabetic nephropathy is, its causes, its stages, and stick around till the end of the video because we shall educate you on how to prevent or reverse this chronic disease. Firstly, what is diabetic nephropathy? Diabetic nephropathy is a type of chronic kidney disease that results from long-term damage caused by diabetes. It primarily affects the kidney's ability to filter waste from the blood. Over time, this damage can lead to kidney failure if kidney biopsy is not performed immediately. Diabetic nephropathy typically develops slowly over many years and is one of the leading causes of end-stage renal disease worldwide. Before we get any further, if you are new here, consider subscribing to our channel because it motivates our team to make more videos like this one. Do you know what causes diabetic nephropathy? The main cause is consistently high blood sugar. Over time, high glucose levels damage the blood vessels in the kidneys. Not only that, but there are other diabetic nephropathy risk factors, for example. 1. High blood pressure. It is also known as hypertension, which contributes significantly to diabetic nephropathy. Patients with hypertension often exhibit insulin resistance and are at greater risk of developing high blood sugar levels, which will last for a long time. Insulin resistance occurs because high blood pressure can constrict and narrow the blood vessels, altering the delivery of insulin and glucose to skeletal muscle cells, resulting in impaired glucose uptake. This eventually damages and weakens the blood vessels throughout the kidneys. 2. Smoking. This is the act of inhaling and exhaling the fumes of burning plant material, most commonly tobacco. Nicotine, a chemical found in tobacco products, raises your blood sugar, causing diabetes. This chronic smoking worsens diabetic nephropathy by damaging blood vessels, reducing kidney blood flow, and increasing oxidative stress. This accelerates kidney inflammation and fibrosis, leading to faster progression of nephropathy. 3. Poorly controlled blood sugar. This usually leads to a condition called hyperglycemia, where blood sugar levels are too high, often due to ineffective insulin use. This damages the small blood vessels and tiny filters, called nephrons, within the kidneys, leading to diabetic nephropathy. The continuous damage impairs the kidney's ability to filter waste and fluid from the blood, potentially leading to kidney failure or chronic kidney disease. 4. Genetic predisposition. It can cause diabetic nephropathy by influencing how an individual's body responds to high blood sugar. Certain gene variants may increase susceptibility to kidney inflammation, poor glucose metabolism, and high blood pressure. These inherited traits make some individuals more likely to develop kidney damage when exposed to diabetic nephropathy risk factors. Members, if you have found this video helpful so far, be sure to give it a thumbs up and also share your thoughts in the comment section below. Continuing, diabetic nephropathy occurs in 5 different stages, for example. Stage 1. Hyperfiltration. This refers to the abnormally high filtration rate in the kidney's glomeruli. It is a key early stage of diabetic kidney disease which has no symptoms. This stage is characterized by an elevated glomerular filtration rate, leading to increased pressure within the glomerular capillaries, which can eventually damage the nephrons and decline the kidney's functions. Stage 2. Normoalbuminuria. It is also known as the silent stage or the quiet stage. This stage starts approximately 2 years after the start of diabetic nephropathy, and it is characterized by kidney damage with basement membrane thickening and mesangial proliferation. Still, there are no clinical signs of the disease at this stage. The good thing, glomerular filtration rate returns to normal values. Many patients remain in this stage until the end of their life. Stage 3. Microalbuminuria. This is the initial nephropathy, the first clinically detectable sign of glomerular damage. It usually occurs 5 to 10 years after the onset of the disease. blood pressure may be increased or normalized, and approximately 40% of patients reach this stage. Stage 4. Proteinuria. This also called chronic kidney failure, which is the irreversible stage. Proteinuria develops when glomerular filtration rate decreases and blood pressure increases above normal values. It manifests large amounts of protein in the urine, indicating kidney damage. Stage 5. End-stage renal disease. It is majorly the last stage, and it's often called terminal kidney failure. Approximately 50% of the patients with terminal kidney failure require kidney replacement therapy, such as peritoneal dialysis, hemodialysis, or kidney transplantation. There you have it, diabetic nephropathy explained. But remember, diabetic nephropathy can often be delayed or even prevented with the right steps, such as keeping your blood sugar levels within the healthy target range, controlling your blood pressure, taking prescribed medications, eating a kidney-friendly diet, low in sodium, saturated fat, and processed sugars. Lastly, quitting smoking, and stay active and get regular checkups, including urine and blood tests. Thank you for watching. See you in our next video.